Welcome, everyone, to another edition of Couch Conversations with the Doctors. We are so excited to be here today as we continue to embrace the community with knowledge and understanding of how to live and be healthy. I'm your host today. Nikki won't be here today, but she gave me the pleasure of joining her today. And for my audience on my low carb channel, this is not a low carb broadcast. We're just having a community discussion, and I'll obviously share my perspective, but my colleagues will do the same. So what we normally do is we introduce ourselves. I'm Dr. Tony Hampton, a family and obesity doc on the South Side of Chicago, and I join this platform periodically to just, again, touch the community, talk on issues beyond my low carb perspective, and I'm always privileged to do that, and I'm gracious to be here on Danny Davis's platform. So we'll kind of go around so you can meet everyone who's here on the panel. Dr. Terry Mason, why don't you go first?
Yes, my name is Dr. Terry Mason. I am a happily retired urologist and practiced for many years before that retiring happened, and also spent time as the Chief Operating Officer for the Cook County Health and Hospital Systems. And a number of other things, but those are the two most outstanding, I think. And I'm also very pleased to be on this panel with my esteemed colleagues, and we will try to endeavor to answer your questions as completely as we possibly can in the way that you can understand. And thank you.
Absolutely. And I just want to say to my low carb fans that Dr. Terry Mason is plant-based. And what's cool about this platform is that you can have essentially a carnivore and a plant-based doctor on the same platform. And I think that's the type of model we need moving forward. I'll come back to you, Karen, in a moment since you're our guest. Dr. Maya, share your background.
Hey, good evening. Most important thing of my background is I'm from the South Side of Chicago, South Side, and I'm a facilitator of community healing. I've been a massage therapist, a teacher. I am a physician and a public health strategist. I'm excited to connect with community. I'm excited to learn from community and from my peers. So we have an exciting topic that much needs to be talked about. I'm excited to be here.
Absolutely. And for those who don't know us, we fight from the South Side to the West Side often, but we do it in love. So we have a little West Side, South Side rivalry, and that's okay. So Joseph Harrington, share your background.
Sure. I'm glad to be here and honored to be here with this prestigious panel. I have an interesting background. I've done a lot of different things, worked in a lot of different fields, but talking about South Side, West Side, I was born and raised on the South Side, proud South Sider. But I spent a lot of time working in North Lawndale. And so I know North Lawndale pretty good. And actually, when I went to my prom date was from North Lawndale. She lived right off of Cullerton and Pulaski. So I have a long history of involvement with people on the west side of Chicago. But most of my work has been done in public health and healthcare. I worked at 3 different hospitals, worked for the city health department 3 times, and retired from the state health department in 2017. Where I was the regional health officer for Cook County and an administrative law judge. And just glad to be here. I want to thank Congressman Davis and Nikki for providing this platform.
Thank you. Honorary West Sider, just because you date the right people. I appreciate that. So, all right. Douglas, what you got for us today?
Well, I can say that I spent 30 years practicing in the western suburbs of Chicago. I mean, that's the only identification I could say. I was in private practice there, and after those 30 years, I joined the representative in his office, and it really opened my eyes to public service and public health. It's a real honor and pleasure to be here tonight, and tonight is kind of a very important night for me because 2 of my aunts died from breast cancer, and 2 of my sisters-in-law are under treatment right now for breast cancer. So this one is very close to me.
Yeah, understood. I definitely feel that. Dr. Miller.
Good evening, everybody. My name is James Miller. I am a retired internist. I retired in 2019 after practicing 40 years. Actually, my practice is over the 40 years, hit every side of town. But I spent most of the time on the west side and west suburban area. But I did practice on the south side and the north side for a period of time. Though I've retired from clinical practice, I am still involved and still trying to do what I can to heal the community of the health concerns that we all know that exist, and do what I can to keep people as informed as I know how. And I'm here today to learn as well as to discuss and teach what I know.
Thank you so much, Doc. And we'll circle back to Karen. Why don't you introduce yourself?
Good evening, everyone. My name is Karen Hall. I'm the founder of Cancer Support Transformation. I'm also a two-time breast cancer survivor and Southside Win. I born and raised on the South Side.
All right, I'm glad you threw that in. I'm still going to show some love. And now we'll allow our leader and a man who has dedicated his life to service, Congressman Danny Davis.
Well, let me thank all of you for a wonderful Monday evening. Joe Harrington, I knocked on doors in that area on 8 blocks Saturday with LaShawn Ford between Pulaski and Costner. And so we hit Cullerton, that whole area there where you were, and just had a wonderful time talking to people. And it was a great Saturday afternoon. But I also want to pull the cover off Dr. Miller a little bit. He's such a nice, honest guy. Just, kind of low profile, low key. And I had met his granddaughter, of course, at the Oak Park River Forest High School. And the other day I was talking to a bunch of executives, bankers. And there was one lady, she was kind of in charge of everything. And there was a M in her name, in the middle of her name. And so I was trying to figure out what the M stood for. Ended up, it stood for Miller. And then I discovered that she was also the vice president of one of these great big banks in Chicago. And so I had to ask about her family. And she kind of said, well, my father is Dr. Miller. I said, no, he wasn't holding out. I didn't know his daughter. I knew his granddaughter was an outstanding student and kind of interested in going to medical school. But I didn't know that his daughter was the vice president of BMO, this great big old bank. And I says, I've been in tall cotton, walking around with these guys. They kind of up there. But it was just a pleasure, Dr. Miller, meeting your daughter and getting to know what she does and how instrumental she has been and continues to be for the thousands and thousands of people who do business with that bank, and how much a part of the community that bank is. And they just opened a brand new branch right here in the community on the west side of Chicago at Madison and Central. It's hard to talk about health without also just noting that our government is shut down right now, which is a dark moment for our country. And we're having a big debate and a big argument as to why it is shut down, what it is that's keeping us from being open. And of course, those of us who describe ourselves as Democrats say our position is we won't back up from health care, and we won't let the other side wreck healthcare delivery in our country. So we got a big fight going on. But we did pass out of the Ways and Means Committee a good cancer bill a few weeks ago. We passed the bill that Terry Sewell introduced in honor of her mother, who had passed away as a result of cancer. And we were able to use the skill and expertise of Terry to coalesce with a Republican who is also chairman of the Budget Committee. They introduced a cancer early prevention and detection bill that we were able to pass out of committee, which means that whenever we go back and agree to do anything, we will more than likely pass it because it is bipartisan. It is something that we were able to agree upon. And we had about 200 cancer supporters in the room urging us on. And as we passed the bill, as it got debated, so at least we were able to do that. So to talk about cancer and keep discussing it and moving it is a good thing to do. So thank you very much, Dr. Hampton, and we're ready to roll.
Well, we appreciate those comments. We're definitely we'll send some prayers to you and the work you guys are doing. I hope we can move forward with the budget and the all the things that you have to do in your work to get things approved. I will start us off. I'll probably ask Karen to join me after I make a few opening comments. And I'll start by saying something that many of you may resonate with, which is we have family members who have survived cancer. For me, my mom survived cancer about 26 years ago. And it was a very scary time. We had lost a couple of family members prior to her. And we were concerned that she would be number 3. So, but the message I have to share about my mom is that she was getting annual exams. And in spite of that, one exam was normal and the next exam wasn't, literally. I mean, and you would think that it would be it'd take time. One exam was normal. So the first message is annual exams, and some people do every other year, but annual exams is probably a good idea for most people to consider. And I think that's why my mom is still here. And I just think that that's the first thing I want to say. And the main thing is that if you are so afraid of getting your breasts done, checked by a mammogram, there are other ways for us to do it, rather than ultrasound, et cetera. So don't let that be a barrier. Of course, it can be uncomfortable for some people, and I get that. So the other thing I want to say is, from my perspective, and this is kind of where at the lane I live in a low carb community, we do have evidence, and we do feel that cancer is something that you can do a lot to prevent. We in the space I live in believe that there may be a metabolic origin of cancer. And what we're saying is that, yes, your genetics play a role, but the root cause of cancer may be something other than your genetics. And it may be the environment that you put your body in, rather it's the stress you're living under, rather it's the sleep you're not getting, but more importantly, what you put on your fork. So, and that belief comes from this idea that cancer thrives, believe it or not, as glucose as its primary fuel. Cancer cells thrive on sugar. And that's why we do PET scans, which literally just puts radioactive sugar in your body, and it goes straight to the cancer. How ironic is that? So it's the fuel source. So when insulin is high, things grow. Insulin is the growth hormone, and that's the environment that cancer thrives in. So for those who are nerdy, you'll hear a term called the Warburg principle. And the Warburg principle by Otto Warburg, he won a Nobel Peace Prize in the 1920s for this, discovered that cancer cells prefer glucose as its primary fuel, particularly in the absence of oxygen. You would think oxygen would be a good thing, but cancer cells love a low oxygen environment. And in that setting, they run very efficiently on sugar. So the takeaway is that if you lower sugar in your diet, if you lower insulin, if you lower inflammation, you may create an environment where cancer won't thrive. So no matter what your genetics, that's something that we all can do. If we decrease body inflammation, we will become more cancer resistant. And that's really all you can do. After that, you got to let the chips fall where they may. So I just want to tee up the conversation with that way of thinking. And again, you can't change your parents. You can change your environment. You can change what you do to make sure your body's in a low cancer state. So I'll kind of wrap up my thoughts with that. But I do want to allow our guest, Karen, to comment. But before we do, I see a few comments from those who are watching us. One is all the way from Australia. Broom free, born free, broom free. I just love that. So thank you for reaching out. Isn't the power of the internet amazing? We also are getting away from Carolyn. Thank you, Carolyn, for doing a shout out. And then we'll let Brune say more. I retired from work. Retire meaning I put on new tires, like on a car, and driving forward into better health. This is more of a carnivore keto person, feeling good, doing well. So congratulations on that. And with that, Karen, why don't you share some thoughts about the world you live in as it relates to how you're approaching cancer and things you could share with us today.
Okay. First off, I was diagnosed twice, eight years between the first and the second. I do not have any family that I'm aware of that has cancer. So as far as I know, I'm the only one. And so the theory that you're saying, it has a lot to do, not so much as the genetics. It's written that about 80% of the people that's diagnosed with cancer, it's not genetic. And if that's have a lot to do with your environment, it has a lot to do with the food that you eat and the way that you take care of your body. One of the messages that I want to say, early detection saves lives. I've been a component of that. I'm also a person that I was doing regular mammograms, and my suggestion is every year. From 1 year, I didn't have it. The next year, they found something. Was it a bump? No, it was no leakage. It was no growth. It was no indication that I had cancer. And it was found from the annual mammogram. So that's very, very important for you to continue with that. And then once it was found, the first time I just had a simple mastectomy, right? Stage 0, simple mastectomy, life goes on. Okay, my world has not shifted that bad. But 8 years later, I was diagnosed with a very aggressive local recurrence, same side that I had my mastectomy. So it's not genetic. I believe, and this is, as my mom say, this is according to, St. Karen, okay, is that it had more to do with the stress that I was under at work. I was under tremendous amount of stress for 10 years straight. And I think that contributed to the cancer reoccurring because I was not eating well. I was not sleeping well, so my body was run down. And so therefore, the results of it come. So to the ladies that's listening, yes, my message to you is get your regular mammograms, right? A few minutes of discomfort saves your life. Right. And that's just how it is. Yes, it's uncomfortable. Another thing is to learn if you have dense breasts, because that's important with dense breasts. very often we have to go and do the second testing, which is diagnostic, right? These breasts are not really shown in a regular mammogram, and so you can have a higher risk of developing breast cancer if you don't get that second layer of, of service. So that's really another thing. All of the older women out there, triple negative breast cancer is running rapid in the African American community. For our younger women, they're younger and younger and younger. So if you have any young nieces, nephews, sisters and sisters, aunts, uncles, please share with them, encourage them to get their mammogram, encourage them to go to the doctor, to start the process, start the conversation with your PCP. You have to be your own advocate. You cannot wait on anyone to come to you. You have to learn how to be your own advocate. I say, and I know I'm on the thing with a whole lot of doctors, I say, if you don't trust your doctor, get another one. Okay? And the doctor is not God, right? So if they say something to you and you're feeling a little concerned about it, ask questions. Ask them to explain it to you a different way. Because we all learn and grasp information totally different ways. So just to finalize, just be your own advocate.
Yeah, thank you, Karen. I'm going to say hi to David. Looks like David loves tennis. I was a tennis player, played for Lane Tech High School. Another good day, I assume, from Australia. So shout out to you. Another shout out from North Carolina. Beautiful place, beautiful weather. Love North Carolina. Another shout out, very important conversations. Thanks, Docs. I appreciate that. And the last one before we move on is here. Ms. Hall, you are so right. I go next week. It scares me every time I have to go. But what's scary is to not know. Because
that's right.
My mom is 26 years ago. And before I opened up to my colleagues, she said, why are these young people getting it? I would say because of inflammation, stress, and insulin resistance and high insulin levels. And the life we live is stressful. And so we have to control our controllables. Maybe stop watching the news every day. Let's control our controllables and reduce stress. And I believe that that's why you're seeing such a high number, because we live in this environment where we're putting ourselves at risk. And I do believe that all of us are fighting cancer every day, but our triggers, our moments when we get it is when we are under a lot of stress, and then our body can't fight it anymore. Too busy dealing with the stress. So I think everything you're saying resonates. So let's open up and see where my colleagues are in terms of any thoughts they want to bring to this conversation.
Yeah, I'd like to jump in. I'm going to try to be brief because I know I don't want to suck up all the time or the energy in the room. But number one, I'm a prostate cancer survivor. I finished all my treatments in September of this year, and so again, cancer is and just to demystify cancer gets its name from where it occurs in the body. So if it's in the prostate, it's prostate cancer. If it's in the breast, it's breast cancer. If it's in the kidney, it's kidney cancer. If it's in the lungs, it's lung cancer. So I want to demystify cancer is a disease. A lot of us are subject to get it. And what Tony talked about earlier are risk factors. There's some that can be changed and some that can't be changed. And so I want to talk about very briefly some of the risk factors that you have no you can't change. First one is your age, your sex. You're either born double X, which is a female, or XY, which is a male. You can't change your sex. You can have sex change surgery, but you can't change your sex. Family history contributes to it. Race, and that is a social determinant of health. It has nothing to do with anything else. Your ethnicity, and we talked about genetics. So those are the things that sort of drive things. But what Tony was talking about, the things you can change and things that you can change. One of the things that Ms. Hall talked about is you can change your attitude. just because you have cancer doesn't mean that you can't have a positive attitude. I told people when I was going through my treatment, and I would tell them I had cancer, but cancer doesn't have me. I was very positive. I knew that I could get through it. I just had to get the treatment and go through what I needed to go through to get to the other side. So you can get through it, but your attitude is very important as you're going through something like that. And the last thing, because again, I don't want to take up a lot of time, is diseases like that, just like Alzheimer's disease, is a disease that affects everybody around you, particularly your friends and your family, because they emote with you and they feel that if you have cancer, it's just like they have cancer because they're very worried about you and they want you to survive, as do you. So those are the people that you need to be surrounded by and you need to include. I know some people are isolated, but if you don't have friends, you might want to make some. Or if you're estranged from your family, you might want to at least say hello to them every now and then, because there will come a time when they will be your best advocates and allies in times like that.
Great advice.
Yeah. One of the things that I would just like to mention, the word cancer seemed to be almost like an explosion ready to go off. And when people tend to think about it, it creates a lot of fear in a lot of people, even fear of not doing the things that they need to do in order to be able to find out whether or not this is a problem that they have. And I think that I've always tried to encourage patients that, not knowing doesn't protect you in any kind of way. And so that you're better off if you do know that you have a problem, because now you can at least address it and begin to receive whatever treatment is available. But but a patient used to often say, and I think that's changed over the years, but still I hear it from time to time. People are saying, I don't want to know, or I'm scared to find out, or those kinds of issues. And I think we need to, and again, we talk about the people experiencing anxiety issues. That's probably an anxiety related situation. However, the only way really to allay that anxiety is to know. Not knowing doesn't really ever relieve you of the anxiety. You may be able to sort of put things aside, but knowing it, you can kind of put things into a category that you can sort of let go. So it's important that you get those things done that will help you to be able to determine whether or not you do or do not have any kind of cancer. So the screening for the various type of cancer, since we're talking about breast cancer mainly tonight, certainly get the mammograms. And also, fellows, this is not just totally a disease of women. Men do get breast cancer as well. So you need to make certain that you get evaluated, get yourself checked out as well.
Nice. Dr. Maya, since you are a lady, what's your thoughts? I'm just curious what's this meant to you? Has it been a scary journey? Has it been fairly, no big deal? What would you say?
Well, I have family members that have transcended due to breast cancer. They were diagnosed when they were in their 50s. However, I just want to point out something significant. There have been a lot of advances in breast cancer treatment. Those advances don't always reach everyone. And for that reason, sometimes the process is longer for some people to get to the treatment. That's why regular screening is important. Black women are 40% more likely to have a poor outcome associated with breast cancer than other women. And Black women are usually diagnosed at a younger age, not because they're screening, but because by that time, like Dr. Mason says, due to some kind of symptom by the time it comes in. So for that reason, if you, like Dr. Mason says, if you're having signs and symptoms, we're already down a path we don't want to be. That's why prevention is important. The other reason why Black women are having it at a younger age, when you're younger, and genetically, Black women are more likely to, as Karen mentioned, what do you want me to call you, Karen? Sorry. All right, Dr.
Karen
Okay.
is perfect.
Okay, as Karen mentioned, Black women are more likely to be diagnosed at a younger age with triple. Oh, I'm sorry, that's my dog. Let me get that in control. Sorry. With a breast cancer, triple negative breast cancer is a breast cancer that lacks some receptors, right? Though when they talk about triple, just to take some mystery off of that, that means that some of the cells or receptors that are used in breast cancer treatment, the type of cancer that these women that we're talking about typically don't have those receptors, right? So the receptors are estrogen, progesterone, and human epidermal growth factor, the growth factor that causes skin to grow on humans, okay? So that's estrogen, a hormone, progesterone, a hormone, and human epidermal growth factor, the receptors for that have been used to create treatments, right? But if you have a triple negative, 1, 2, 3, right? Estrogen, progesterone, and human, we call it HER2. If the receptors are not there, then the treatment is not going to be effective, right? Because the treatment is looking for those receptors in order to attach itself and do what the treatment needs to do. And because of that, yes, there are advances and other treatments are coming out, but because of that, Black women are more likely to have those reasons. Black women are more likely to have poor outcomes. So, we talked a lot about what the situation is. What is the guideline? Well, there are about 4 or 5 entities that have these guidelines for this. The mixture of the stuff there are all guidelines. I think I'm dating myself. I'm almost 50. I remember when breast cancer treatment started at 50. Now it starts at 40 because we found out Black women were getting it at a younger age. And spoiler alert, there are Black women that are getting it at younger than 40. So I don't want you to be listening and start thinking, oh, well, I'm 30. I don't need to get screened. You can do your exams, or you can talk to your provider about it. I've never declined to screen a person if they've requested a screen, no matter what their age is, and so guidelines. Basically, screening starts at 40. There's some people that say you can screen every 2 years. There's some people that screen every year. I tell my patients start at 40, screen every year. My computer is dying. And the screening is usually a mammogram, but here is another. The screening of a mammogram is based off of breast tissue of people that are not Black. So what we know is Black women often lead, even in the mammogram screening, to end up going and getting these, and then it sounds scary, like these diagnostic mammograms, right? And a lot of the patients that I screen, they get their regular mammogram, kind of they put the tissue of the breast between some plates and squeeze, They also have these newer machines that are said not to be as uncomfortable. And they scan like an x-ray kind of. Now, because Black women typically have younger breast tissue, and I'll talk about my body, right? I have a body that when I went through puberty, I got breast, right? And the breast tissue was firm when I was a teenager, right? As I matured, that breast tissue changed to more of a fatty consistency, but not everywhere, right? It changes a little bit in different sections. Black women, we keep the young tissue longer and genetically. And sometimes when I go get that smash mammogram, I shouldn't say smash because people don't like it, but the standard routine mammogram, I will say, because I have spots of younger breast tissue, I'll be referred for an ultrasound to really look at the younger tissue and really make sure there's nothing in there. So if you're out there, you have the younger tissue, breast tissue are not as fatty yet, because we're going to mature and we're going to live long, and that's part of life, right? then when they tell you got to get a diagnostic, don't freak out. It's an ultrasound.
Yeah.
To look at the density. And so there are companies that actually have looked into this. Companies like, I think, Density Matters, things like that,
Yes.
that have looked into this. And so go get that one. Don't delay it, because something I also see in the office is you get the mammogram. And because some of the standards in healthcare we've set do not belong to genetically our community, we think something's wrong with us. You know what I'm saying? And I would be like, man, we got people going under the knife to have our bodies, and we think it's something wrong with us. Come on, when? You know, can't wait till we all love ourselves. But we think something's wrong if we have to go to that second one. You may just also have more dense tissue and need that ultrasound. And so sometimes I see that delay, because I think Dr. Miller was saying, I don't want to go because they might find something, things like that. Well, let us find it early. So let us deal with it early. Let us work for you, is what I would kind of say about that. The other thing, last thing, Black women have a higher rate of having breast cancer, not diagnosed with that mammogram because we get it younger, but diagnosed when you get go to the dentist. In the gum, that's not the gum, the jaw, in the mandible, sometimes those lesions can show up right on your dental x-rays. Right. So keep that in mind. I have a plethora of friends. There are two things. Sometimes it shows up on the dental x-ray first. Right. But also in the bottom, along the bottom right here. But also genetically, people from the African diaspora do have different density of jawbone right there. So it can be, especially if you have the inner line. Oh, it's not showing up. But the bottom, I have it. The bottom of your tongue, the bones kind of go like, can you see me? No. Okay, you see my hands? The bones kind of go like they would. Oh, you can see my face. So the bones kind of have this structure where they would go in like this. We call that kind of being tortuous when it kind of does like this instead of the bones coming straight out. You may have something that's not that, but when you go to the dentist, you get your x-rays, tell them to look at that bottom jaw and tell them if you see anything. They may see like what I have, this little bony projection from the outside of my jawbone to the end. Still let them look at it, send you to a specialist, whatever they need to do to make sure that's not the first sign of breast cancer.
Insightful. Let me share what our friend in Australia has shared, which is that stress is occurring at younger ages. We kind of echoed that. We're 100% agree. And he also said something that even our congressman will resonate with, which is in Australia, breast cancer screening is free. So it'd be nice one day to live in a country where healthcare, including this, is free to everybody. Some people would argue, well, we got Medicaid. I'm saying there are plenty of people who lose their lives every year for lack of access, and it's disproportionately affecting certain communities more than others. So I think before I have my colleagues tee up any other thoughts, I want our guest, Karen, to share a little bit about the work you do, because I'm looking at cancer support, ... So talk a little bit about what that, why did we invite you? Who are you? Tell us more about it.
Okay, so I am the founder of Cancer Support Transformation. Actually, I just announced last Saturday at my big 6th annual Pink Ribbon fundraiser that I changed the name of my organization. It originally was Cancer Support Team. I started the organization in 2019 for the simple reason when I went through cancer, there was a lack of support in my community. Even as far as the wig, I could not find a wig that I would like, right? I could not find a support group for people that look like me to understand the things that I was going through. I could not find, the medical team was not letting me know about all of the different resources that was out and available for me. A lot of those things I found from other people going through cancer. So in 2019, I felt it necessary that I need to be the support that is not available in our community. So the services that I provide is I host a survivor support group meeting the first Wednesday of every month. Every quarter, I host a caregiver support group meeting because, as it was mentioned on this platform, our caregivers, they go through the same emotional stress as the person is diagnosed, but feel that they really should not have a voice because they're not the ones that's being diagnosed. So I do support them in their journey. I do one-on-one support. On my website, I have a resource list because when we're diagnosed with cancer, we're impacted with life. Everything else is still going on. So there's resources for bras, there's resources for transportation, for additional support as you're going through your journey. Other things that I do, I give away free wigs because, we got to look cute, right? Just because we're going through cancer, we can't look cute. So I provide free wigs to our cancer patients and survivors, and also women living with alopecia. And so I'm there. I'm a patient navigator. I'm with UIC. I'm co-facilitating on a breast cancer learning collaborative. And so I have a lot more of the insight as far as helping the patient, not just to get them to the doctor, but also walk along with them as they go through their journey through survivorship. And so I'll be there to assist, to help, to give them some resources, to kind of guide them, when they're going through surgery, kind of what to wear if they don't have anyone to go with them. We're just being there to walk with the patient.
I want to mention a couple of things just to kind of provide perspective. One is 1 in 8 women in the U.S. develop breast cancer during their lifetime. Now, think about how striking that statistic is. And I'm pretty sure that if we went to communities of colors, it would be even higher percentage.
Yes.
Number 2, we talked about breast cancer not being necessarily a genetic disease. And what that's saying, and that's why we think it's a metabolic disease. Every cancer has metabolic dysfunction. Every cancer has mitochondria, the factories that make energy, dysfunction. So, but not all cancers are genetic. So is genetics important? 100%. And that's why that 40 age that we start at now that Dr. Maya spoke of may have to be earlier if someone in your family started. If they had cancer at 45, you may have to do it at 35. So you want to be aware that it's specific to your particular situation. But what's really cool, the stat that really blew my mind was that early stage breast cancer, like my mom had, she took a mammogram and then a year later it was abnormal. The survival rate is 90% or higher if you get it early. Think about that. So if we simply just screen and get it early, so all this fear about, I don't want to know I have cancer, is based on that stat is false. It's fake news. In other words, know it so we can do something about it. Yeah. My other colleague suggested that, yes, men can get cancer. It's not common, but yes, there are men who can get cancer. So if you feel a lump or something abnormal in your breast tissue and you're a male, please make sure to get it. And if you're over 75, because we tend to do 40 to 75, as a clinician, we can use clinical judgment. As a patient, you can use patient judgment. And if you feel I'm making it to 100 anyway, you may then decide, since I'm going to live longer, I might as well keep checking my breasts, because, and that's a decision. And why do we not do it for everybody until they're gone? Well, because there are risks of doing procedures in an elderly person. There's biopsy risk, there's treatment risk. So we want to make sure we're very individual after 75, but know that there are 80-year-olds getting mammograms. There are 85-year-olds, but a lot of it is based on we think they're going to be here for a while. So I just wanted to just bring a few more thoughts to this conversation as we discuss it with the group. So Joseph, what you got for us?
Yeah, I'm going to try to be brief because I know we're getting close to time. And I want to take a step back and actually talk about this, a couple of things. One is uh, we're probably more likely, and I'm talking about African Americans, Black people, to have access to care, but more likely to die prematurely. And I won't get into why that is the fact, but I think it's important because there's a relationship between having access and knowing you have access and getting care. And there's also the issue of the utilization of that care. So that's something that I just want people to keep in mind moving forward. The other thing, and I want to go back to this idea of dense breast, because I first learned about it when I worked at Rush and I was doing recruitment for the Women's Health Initiative, and learned that women with denser breasts had a much more likelihood of developing breast cancer, and that's like 2 to 3 times. So what I want to go back to, and perhaps Dr. Maya can talk about that, because nobody talked about knowing your body and self breast exam. I mean, there's some things, simple things you could do at home, and you may be able to detect something that's changed in your breast if you do regular breast exams. But I think that's a more appropriate topic for Dr. Maya to cover.
Okay.
Can you guys hear me? Hello?
Yeah, go ahead, Doc. We'll let
Yeah,
you go first.
Yeah, I'm sorry. Whatever reason, I lost power. For some reason, I just had to get it fixed real quick. And I just wanted to add something real quick. Number one is we don't guess. We get a test. Don't guess. Get a test. You don't go by how you feel. Don't go by what other people may have told you. But the only way to get to diagnose this disease early is to get mammography, and also getting the appropriate follow-up with a biopsy. And the only other thing I'd add to this is that don't be afraid to advocate for yourself. A lot of times you may get pushed back because the schedule is busy or what have you, but be your own advocate for yourself. You are important to yourself and your family and people that love you. So you sometimes have to be, and I'm not saying it unruly, but be aggressive about getting these information. Other last thing I wanted to say real quick is don't go by the presence or absence of symptoms. Don't think just because you don't feel something that everything is okay. And if you definitely do feel something, you definitely want to get that having a look at that by a professional. So, just make sure you do all the right things yourself, and you have to stay away from folks that are not necessarily professionals in terms of getting advice. Always get your advice from your primary care doctor, and so that you can and then always follow up on your mammogram. Always follow up. Just don't assume because you didn't hear anything that everything is okay. You want somebody to physically tell you mouth to ear that everything was fine, and that you want that to be very, very clear. And lastly, for those up there, I've been doing a lot of work, the Congressman knows, with Mile Square, and almost all hospitals now, if they treat women, they have the capability to make sure they can either get or refer you to some place to get your mammography. But don't guess, get a test.
Yeah. Dr. Maya, what you got for us?
So
It went back to mute, Doc.
Oh.
There you go.
Can you hear me now? Sorry.
Yes.
When it comes to breast exams, the standard guideline says do an exam every month. No, I'm sorry. I said the standard guideline. Sorry. No. The recommendation, if you're going to do a breast exam, is to do it at least once a month, typically 3 to 5 days after menstruation or after your period, because the breasts are less swollen. A lot of people don't like to do it because of tenderness, right? I tell people when you start to do a breast exam, if you're new to doing breast exams, I should say do it 1 month, do it week, and we're going by menstruation weeks, okay? do it week 1 and do it week 3 just to see a little difference, because the texture is going to change, right, during your cycle. And then the next month, do it week 2 and week 4, and just keep playing with that until you find a rhythm that works for you. I always say do it at least twice a month, because the texture of the breast will change. Once you get really familiar, if you want to do it once a month, that's fine. And you do a couple of things. Angel wing. You stand in the mirror and you take a look. First, you do an angel wing facing the mirror. Oh, I don't know if you can see me. Oh, let me turn this off. Hold on. How do I turn off my background? I didn't realize that it was on standard definition. Okay, I don't know how to visual effects. Okay, background none. Okay. Okay, so can you see me now?
Yeah, we got you.
Okay, you stand. My shirt says, and I'm gonna only get finer. I didn't know what to say. Okay, but anyway, you do a little angel wing to the mirror. You would not have on your shirt or anything covering your body. You would just look at the breast tissue, and you do your little angel wings. When I do my angel wings, I'm looking for all the way up, all the way down, and then I do my little hands on my hips, and I make my back go like that, and I stick them out. So I do it facing, and then I do it sideways, and I do it sideways. And what I'm looking for is, I can only see me, and now I don't know what I did, but any kind of dimpling. And once you do it often, you'll know kind of how, because people's breasts are different sizes, different shapes, different densities. They're just different. Everybody's body is different. So once you know your cadence, your routine, and how your body is flowing, you're looking for any pulls, puckers, wrinkles, anything new. Some people are born with nipples that kind of go in. So if that's your normal, that's your normal. But say you had a nipple that was going out and now it's going in. Any changes, any discharge from the nipple. Typically a discharge, and they normally say bloody discharge, but I've had patients get diagnosed and they had a milky discharge, especially if you're not pregnant. And it usually is just coming from one breast instead of both, right? And so you're looking for any sores, lesions, stretches where it's kind of stretching like that, any puckering, any going in when it used to go out, things like that. When you do that, that's part 1. Part 2 is when you lay on the pillow and you put the pillow behind the side, the breast you're going to examine. And then you put your hand behind your head like you're laying on the beach, right? Breast tissue starts in the underarm. In fact, most breast lesions are found out here, right? The upper outer quadrant. And so here's my breast tissue. It goes all the way from the underarm, all the way. Okay, the screen is backwards to what I'm doing. So all the way from my underarm, all the way to my little neck bone place, right? And I'm laying flat now with the, it goes all the way down, and I tell to the bottom of my breast, and all the way back out to the underarm and up. And I'm gonna take 3 fingers like this, right? And these are the pads. And I'm starting in my underarm. I'm giving, what do I call it? Baby bear, middle bear, strong bear. And I'm doing my little rolls. I'll do it to my neck tissue right here because it goes all the way here anyway, from the underarm. I'm doing baby bear, middle bear a little deeper, and then strong bear as deep as I can. So I'm examining all the tissue, right? And you just go to that, even on the part of your tissue breasts that are protruding, because you're laying down and you're on the thing, it's gonna go ahead and flatten that out or move it over to the side, and you do it. And I like to, some people do spokes on a wheel like that. I go up and down like a little over, up, down, over. And I just keep going until I go to the clavicle and back. And I do that sometimes if I'm watching a movie, things like that. Some people choose to do it in the shower. I like to do it laying down because if you're laying down, then you have something in the back pushing the tissue and kind of more stabilizing the tissue. If you're in the shower, you got gravity kind of moving things around. And sometimes I don't feel like I have as much coverage, or the patient doesn't feel like they have as much coverage. And that's how you do a self-breast exam. Now, what happens if I'm like, oh, okay, I'm on week 3, and I usually have all fatty tissue on week 3, and now I feel something that's a nodule that I can't just pick up. It's not rubbery. It feels like a rock, and it feels like something stuck, right? That's when you call. That's not when you wait till your next visit. That's when you call your healthcare doctor and you make your appointment and let them know you need to see them. If you have any discharge, whether it's bloody, whether it's yellow and clear like snot, like allergy snot, whether it's not clear like greenish, whether it's milky and you know you're not currently pregnant and it's only coming out of one, any inversions, anything on my angel wings, things like that, that's when you come in and your doctor can help you kind of navigate that. And usually if people come in and tell me that, I do the exam myself, yes. Oh, then on the nipple part, this is be my nipple, you do want to catch it between 2 fingers and give it a squeeze to see if you can, if anything comes out, right? And usually I'll do that exam for my patients. And if they're feeling it, because maybe you felt it on week 3, but now you're in the clinic and it's week 4 and I can't feel it, you know your body, I usually go ahead and refer for that mammogram.
Well done, well stated. And I don't think any of us would have done a better job. So I want to just do a shout out to you for highlighting. I'm so grateful that we're able to expand you, but particularly for that. I'm sure our guest Karen was impressed. So we're kind of nearing the part of the conversation where we wrap up. I do want to throw up this comment. Our friend in Australia has been very engaged. I want to thank you for, I don't know what time it is in Australia, but whatever it is, I'm so happy you're with us today. And I will just say, yes, your lymphatic system is important because that's your body's like natural drainage network. That's where we remove waste, toxins, and things like that from the body. And the breast tissue is rich in lymphatic channels, trust me. So how do you make that more effective? That's why it's important to be active. You want to be hydrated. You want to take deep breaths and just, and just take care of yourself. You want to be an active person. The more active you are, the more you're going to have a vibrant system. And I guess we got clarity. It's 2:30 a.m. in our friend's country. So he's waking up and we're going to sleep soon. So it's a beautiful thing. The people who help edit my videos on YouTube actually are 12 hours. So when I go to sleep, I send them some, and then when I wake up, they've edited my video. So it's a beautiful thing. That's why I think the world is great. So we're going to pause and take a moment to let everybody share until next Monday. That's our tradition. And we'll kind of end with Karen and Congressman. But let's start with our good Dr. Miller.
Okay. Well, I think this has been a great conversation, and hopefully our audience has really, gained some perspective and some understanding of how they can look and take care of themselves better. These are very important things. Some of it obviously involve how you look at yourself, how you examine yourself, and make certain that you are really giving it the attention. Your body needs your attention, and make sure that you give it that attention. So I think that the information that was shared tonight is very important information that may prolong your life. So make certain you follow it.
Thanks, Doc. Dr. Graham.
So I'm going to say that I think this is a very difficult and challenging time to be a patient. And it's hard because access is getting harder and harder. And now there's so much information coming from so many sources. I just want to reinforce what Dr. Mason said. You need to use your primary care doctor as a resource. I cannot believe how persuasive influencers are and bloggers are. But the truth of the matter is, it takes 30,000 hours to become an expert, not 30 hours on Google. And one of the saddest things that I've seen in my life is when someone is persuaded to take something because it's natural and healthy for you, and you lose every opportunity to address this cancer in effective scientific ways. So please use your primary care doctor for advice and guidance, because the consequences of not doing it will be something you'll probably regret.
Thumbs up, just like Carolyn shared. Dr. Mason, until next Monday.
Thank you very much for the opportunity. Thing I would always say is, and I've said it 3 or 4 times already, don't guess, get a test. You know, we don't have to try and figure this out. Don't guess, get the test. And it's for you. And you got to make you important to you. And don't put it off. Don't not, put something else in its place. And I know we got things that conflict with what we need to do, but you're the most important thing you've got. So you take care of you first, and then you'll be able to take care of all those other things a lot better. But if you ain't here or you broke down because of some other things, it's not going to work. So take the advice that you've heard on this video tonight and others to get what you need to get done. Love you, some you.
All right, Doc. He's well stated, and appreciate your thoughts. Dr. Maya, until next Monday.
First, I know, Karen, you've been doing and maybe talking about breast exams more than I have. Was there anything missed on that one?
The only thing that I really wanted to just mention was that I was diagnosed the first time. I did not have any symptoms, no leakage, no bumps, no discoloration, no nothing. So that's why I'm a really big component of early detection.
Thank you so much. That'll be mine until next Monday. The point is, as a physician, we know what we see. We know what we hear from community. But you see, there are times when with all that being said, you have to advocate for yourself. And there are times when we will, sometimes as best as we can, present something. But there are other factors that belong to you. And so you have to speak up and advocate with your doctor. That's mine until next Monday.
Absolutely. Joseph.
Yeah, I'm going to take a different course in some respects. I want to remind people that each of us and each of you are more powerful than you realize. You have the ability to make those decisions and make a change that other people can't. And they can't do it for you. You have to do it for yourself. One of my favorite philosophers, and a lot of people didn't like him, was Friedrich Wilhelm Nietzsche. I read a lot of Nietzsche when I was in college. And one of the things that he said, that which does not destroy me makes me stronger. And I want to paraphrase that by using a quote from Oprah Winfrey: where there is no struggle, there is no strength.
All right. Thank you so much. Let's go ahead, Karen, and let you provide your closing comments.
Actually, I am very honored to be here. And the only closing comment is what I mentioned before. Be your own advocate, early detection, get off the internet, make sure that you go to, really knowledgeable, the right resources, National Cancer Institute, American Cancer Society. Go to the best resources on the internet when you're searching for the information. Knowledge is power, but make sure that you're getting it from the right sources. Thank you.
Thank you so much for being here. You provided wonderful insights, and very proud of the work you're doing and the lives you're impacting. So continue to do that work, living your purpose. Every single
right, living in my purpose.
Isn't that cool, to live your purpose? And I encourage everybody to do the same. And before I hand it over to our esteemed leader, Congressman Danny Davis, I'll just say that early detection is really hope in action. We're constantly reminded that you need data, you need information. So let my mom's story of survival 26 years later be a hopeful message that that can be your story or the story of somebody else in your life if they'd only be tested. So encourage your family to get tested. I love the fact that we have an awareness month, but I think it's a mindset that I'm going to do everything within my power to control what I can. You are not powerless. Your destiny is not what you've been told it is. You start healing the moment you realize you have control. So continue to do that. And hopefully this panel's discussion will inspire you to do just that. So with that, I'll pass the baton to the Honorable Congressman. Thank you, sir.
Well, let me thank you all. As a matter of fact, as I was listening and trying to decide in my mind how amazing it is that so many people can say the same thing in different ways. And so I was trying to figure out what would I say that has probably changed the most since I got real interested in this subject of health. It has been focus on self-advocacy, knowing that whatever it is that anyone else can do with and for you, that the ultimate oftentimes resides with and rests with you, whatever it is that you do for self. And so self-advocacy is a concept that has continued to grow, develop, become an intricate part of treatment, awareness, promotion, probing, asking. And that's really been it. That at the end of the day, no matter what it is that an institution or even a provider, the greatest experts in the world, no matter what it is that they do, the bottom line becomes what you do, what I do. No matter what you know, if you don't do it, it doesn't really help you the way that it could and should. So it's been a great discussion, unbelievable analysis, great conveyance. So thank you all for a wonderful evening of intellectual appropriation of information, all in different ways, but everybody said essentially the same thing. Thank you all so much. I'm going to go get some dinner.
Everybody have a great night. Thank you to all. Have a great night.